Hey everyone, welcome back to the channel. If you're watching this video, you probably saw the headlines this week and thought, wait, what's happening with my Social Security? And I don't blame you because what just came out of Washington is making a lot of people nervous. The Trump administration just announced plans that could change how hundreds of thousands of Americans qualify for Social Security disability benefits. And look, I know these stories can be confusing with all the political back and forth. So I read through the actual reports and the official statements so you don't have to. I'm going to break down exactly what's being proposed, who it affects, and most importantly, what you need to do right now to protect yourself. So stick with me through this whole video because there's some good news mixed in here too. And I'll share some action steps at the end that could really help you. Here's what's happening. According to multiple sources, including the Washington Post, the Social Security Administration under the Trump administration is preparing a plan that would make it significantly harder for older Americans to qualify for disability payments. Right now, the SSA uses something called a grid system that takes into account your age, your work experience, and your education level when deciding if you qualify for disability benefits. And here's the key part. If you're over 50 years old, the system recognizes that it's harder for you to switch careers or find new work if you become disabled. So age is actually a protective factor in the current system. But according to the reports, the administration is considering two major changes, either raising that age threshold from 50 to 60 years old or eliminating age as a factor entirely. The Washington Post cited internal documents showing that this could affect approximately 750,000 people. That's 4 of a million Americans who might lose access to benefits they're counting on. Let me be really clear about who we're talking about here because this isn't just numbers on a spreadsheet. These are real people. If you're a factory worker who's been doing physical labor for 30 years and your back gives out at age 52, under the current system, they recognize you probably can't just retrain for a desk job. But under the proposed changes, you might be denied. If you're a single mom in your mid-50s who develops a chronic illness that makes it impossible to work, you're looking at this news and panicking about how you'll pay rent. If you're a veteran dealing with service-related disabilities and you're under 60, this could directly impact your ability to get the benefits you earned. And here's what really gets me. We're also talking about people experiencing homelessness. Just 2 days ago, another report came out that the Trump administration abruptly ended federal support for a program that was helping disabled people who are homeless or at risk of homelessness access their benefits. This was described as a, quote, highly effective intervention, and they just cut it without warning. So, let's talk about the reasoning behind these proposed changes. The administration's argument is that they're trying to reduce fraud and make the disability system more efficient. In fact, earlier this year in August, the White House put out a statement saying they've identified more than $1 billion in cost avoidance and efficiencies in Social Security this fiscal year. They're framing this as protecting taxpayer money and streamlining a system they say has too much waste. And look, I think we can all agree that fraud is bad and efficiency is good. Nobody wants their tax dollars wasted. But here's the problem. Making it harder for genuinely disabled people to get help isn't the same thing as stopping fraud. You're throwing out the baby with the bathwater. The current age consideration exists for a reason. Study after study shows that workers over 50 face real barriers to reemployment, especially if they have limited education or have only worked in physical labor jobs. The system isn't being generous, it's being realistic. Here's what else is happening that you need to know about. Back in August, the administration also announced plans to cut supplemental security income, that's SSI, for nearly 400,000 low-income disabled and older people. This is a separate program from Social Security disability, but it serves some of our most vulnerable neighbors, disabled children, elderly people living in poverty, adults with severe disabilities. The proposed rule would reduce or eliminate benefits for people who live with family or friends. So if you're disabled and you move in with your sister because you can't afford rent, they want to count that as in support and cut your check. Think about how cruel that is. We should be encouraging families to help each other, not punishing them for it. So when you add it all up, the disability age changes, the SSI cuts, the elimination of homeless outreach support, you're looking at potentially over 1 million Americans who could lose benefits or have a much harder time accessing them. Okay. Deep breath, because I promised you some good news. And there actually is some. First, these disability changes are still just proposals. They haven't been finalized yet. That means there's still time for public comment, for advocacy groups to push back, and for Congress to intervene. Your voice actually matters here. More on that in a minute. Second, President Trump has repeatedly stated that he will not cut Social Security retirement benefits. Back in March, the White House put out a fact-check statement saying the Trump administration will not cut Social Security, Medicare, or Medicaid benefits. Now, you'll notice they're talking about retirement benefits specifically, not disability, but it's worth noting that full benefit cuts aren't on the table. Third, there has been some genuinely good news this year. The Social Security Fairness Act, which passed with bipartisan support, has already sent over $17 billion in payments to more than 1 million eligible beneficiaries 5 months ahead of schedule. This helped people who were being unfairly penalized, including many retired teachers, firefighters, and police officers. And finally, the Social Security Administration has been working on improving customer service. They've rolled out better phone systems and automation that's actually helping people get through to a human faster. I know that sounds small, but if you've ever spent 4 hours on hold trying to talk to someone at Social Security, you know that matters. All right, here's your action plan. Whether you're currently receiving benefits, you're thinking about applying, or you're just worried about the future, here's what you should do. Number 1, document everything. If you have a disability or health condition that affects your ability to work, start keeping detailed records right now. Doctor's notes, medical tests, work restrictions, all of it. The harder they make the system, the more documentation you'll need. Number 2, if you're over 50 and you're thinking about applying for disability, you may want to apply sooner rather than later before any rule changes take effect. Applications take time to process anyway, so getting in the queue now could protect you under the current rules. Number 3, contact your representatives in Congress. I'm serious about this. Call your senators. Call your House member and tell them you oppose changes that would make it harder for disabled Americans to get benefits. Congress has oversight over Social Security, and they're hearing from lobbyists. They need to hear from real people, too. Number 4, if you're already receiving benefits, stay informed, but don't panic. Changes to disability rules typically affect new applicants, not people already in the system. But do watch for any letters from Social Security and respond to them promptly. Number 5, connect with advocacy organizations. Groups like the National Organization of Social Security Claimants Representatives, the Center on Budget and Policy Priorities, and disability rights organizations are fighting these changes. They have resources, they're tracking developments, and they can help. Look, I'm not going to sugarcoat this. If you're someone who relies on Social Security disability benefits, or you might need them someday, the next few months are going to be important. These proposed changes would make an already difficult system even harder to navigate. But here's what I want you to remember. You're not alone. There are millions of Americans in the same boat, and there are people fighting for you. Advocacy groups are already pushing back hard on these proposals. Members of Congress are speaking out, and channels like this one are going to keep you updated every step of the way. The disability system exists because we as a society decided that people who can't work due to medical conditions shouldn't be left to suffer. That was a moral choice we made as a country, and it's worth defending. So please take care of yourself. Check on your friends and family who might be affected. Share this information with people who need it, and remember, knowledge is power. The more you understand what's happening, the better you can protect yourself and advocate for change. If this video helped you understand what's going on, please give it a thumbs up so more people can find it. And if you haven't subscribed yet, click that subscribe button and turn on notifications so you don't miss updates on Social Security, disability, SNAP, housing help, and all the other programs we cover. I've also got other videos that might help you. I'll link to our complete Social Security disability guide in the description, plus our video on how to appeal if you get denied. These resources have helped thousands of people, and they're completely free. Drop a comment below and let me know. Are you worried about these changes? Have you had experience with the disability application process? I read every single comment, and your stories help other people realize they're not alone. Thanks so much for watching, and I'll see you in the next video.